Some requirements for a denture cleanser is something that's easy for the patient to use, bactericidal and fungicidal, non-toxic, harmless to the dental materials, and reasonably priced. A soft tissue exam and oral cancer screening are recommended at least twice yearly for all patients with a denture. Also informing the patient to seek dental care when experiencing any change or concerns with the denture, whether it needs adjusted. It is very important to perform adequate tissue and denture care. Maintaining denture care will aid in preventing irritation to soft tissues. It will remove rough deposits of biofilm and calculus, and it also prevents mouth odors. It is very important to clean the dentures manually after eating and at nighttime. Every day the dentures should be taken out and soaked with a denture solution. If you are unable at any time to fully clean the dentures after a mealtime, rinsing is still advised. The oral mucosa can negatively be affected by the constant contact with the denture. This can result in denture stomatitis. So the patient will need to plan a time when the denture can be left out of the mouth for a period of time every day to give the tissue a rest from the constant contact. The most convenient time is typically while the patient is sleeping, and the denture should always be kept in warm water or a denture solution while out of the mouth to avoid warping. So first, to get the denture ready to be cleaned, you'll need to rinse the denture thoroughly to remove the saliva and food debris. If there's any adhesive used on the denture, the patient will need to remove it with a denture brush. And they will also need to use a soft toothbrush to brush the gum tissue to remove any adhesive. You will also want to rinse and clean your gum tissue with adhesive or not with a soft toothbrush 2 or more times a day. You will then soak your denture in a cleaning solution. Typically, it's suggested 10 to 15 minutes, but you will read the manufacturer's instructions because it does vary. These solutions are only effective on soft biofilm, so brushing with a denture brush is still advised. Invasive agents can cause scratches, which can cause biofilm to accumulate. Each time the denture is removed, the mouth should be rinsed with a fluorinated water or a mild salt rinse unless the patient has dietary salt restrictions. At least once a day, the toothbrush with a round-ended brush should be taken over the vestibule and the ridges of the denture with long straight strokes from posterior to anterior. You should also be cleaning the tongue. You can do this with a tongue cleaner and scrape from the back of the tongue to the front using light pressure, or you can use a soft toothbrush. You will also want to stimulate the gum tissue to help with circulation and increase resistance to trauma. So a massage that is suggested can either be with your finger and your thumb over the ridge, applying pressure with a press and release stroke, and the palate can be rubbed with the ball of your thumb. You can also use a soft toothbrush and use a circle motion across your soft tissues, and you want to be very careful to avoid scrubbing with any hard pressure. Once the denture brush is soaked in a denture solution, you will want to ensure that you're rinsing off that denture solution so the patient's not putting it in their mouth after having that soaking. Denture solutions can come in powder or tablet form.